The mayor of Tucson on what reopening the economy looks like to her.
Mayors are the front lines in terms of jurisdictions of what we're seeing on the ground with our communities.
Plus, the pandemic's impact on Arizona's farmers.
We have to improvise and adapt constantly in the agricultural industry.
And the push to get more personal protective equipment to Pima County.
Some of our long-term care facilities have issues.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thanks for joining us. Ongoing efforts to flatten the COVID-19 curve have given rise to questions about when and how Arizona plans to restart its economy. Governor Ducey offered some answers this week. An executive order issued by the governor on Wednesday says beginning May 1st, hospitals can resume elective surgeries as long as they have adequate capacity.
It will be a slight tick up on the dimmer switch for our economy.
He also discussed plans to ramp up testing, both for active cases of COVID-19 and antibodies to the disease. For the rest of April, Arizona's stay-at-home order remains in effect, but what happens next is less certain.
Each decision is going to be guided by public health first and foremost.
Governor Ducey says he will revisit his options in the coming days. We asked Tucson Mayor Romero about the approach she hopes the state will take and how that will guide her response.
We are not seeing a decline in COVID-19 cases. We are not seeing widespread available testing, and we are still not seeing the capacity ramping up for contact tracing. So unfortunately, I do not see May 1st as being open for the community to and businesses to open back up. And that's based on the facts that we have in front of us.
Do you see that time frame opening up at all in the month of May, or at this point are you looking toward June and July?
As long as we do not see COVID-19 cases decrease, I believe it's 14 days of continuous decrease, then it's very hard to predict when that time frame is going to be. What we do know based on modeling that Pima County has shared with us is that the worst is yet to come. It's still happening, and that we will start seeing a decline at the end of May. But I agree with the phased approach. I really want to thank Governor Ducey for having an approach that is careful and based on science, based on what we're seeing.
How often do you speak with Governor Ducey and his staff about COVID-19?
The governor had been having daily calls with mayors across Arizona when the crisis of the pandemic first hit. The past 2 weeks, he's been having two calls a week. Their communication to mayors across Arizona in terms of information of the steps that they're taking has been very good. I'm concerned about the decrease in our calls because that is a way for mayors. Mayors are the front lines in terms of jurisdictions of what we're seeing on the ground with our communities. And so it's important that we continue those conversations, those calls with the governor's office. And it's very important that the input of mayors continue to be part of the decision-making process here in Arizona.
There are families who are watching this. They're struggling to put food on the table, small businesses who are grappling with the possibility they may never reopen their doors again. What is that plan to fix the economy here in Tucson?
The city of Tucson received $95 million to put into the response for COVID-19. So I will continue advocating with our congressional delegation for revenue replacement for the city of Tucson, because just like every other business, we have more than 4,000 employees to worry about. And since cities live on sales taxes, we have seen those sales taxes decline. We've seen the sales Texas declined 25% in March alone. The other portion is that we've created a Somos Uno, We Are One resiliency fund. That fund has three legs to the stool. It has a small business component, a nonprofit component, and a workers and their families component. We just put $1 million of City of Tucson funds in our small business component to work with a business development finance corporation to do zero interest loans. Nonprofits are going to see less donations coming to them, and these nonprofits are serving vulnerable populations, and then of course the small business portion. The other thing that I'm working on is I'm putting together an economic development advisory council with people that represent the University of Arizona, that represent workers, that represent restaurants, small businesses, and experts in economic development, so that we can start talking about what the city of Tucson can do in terms of policy to turn around the economy in the city.
Regina Romero, Mayor of Tucson, thank you.
Thank you so much, Lorraine. Really appreciate you all.
City leaders, of course, aren't the only ones waiting to find out how the state will move forward. Workers and employers alike also want answers. But so far, the pandemic has proven there are no easy solutions. We discuss some of the challenges ahead with Zach Yenser, host of 1030 KBOI AM's Tipping Point in Tucson, and Steve Goldstein, host of KJZZ's The Show in Phoenix. This is tricky because we don't have all the statistics given that the testing is not available, but we have a population of about 7 million people. At this point, again, as I mentioned, it's April 22nd. We have 5,400 reported confirmed cases, more than 200 deaths. If you're only looking at numbers, those really only affect 1% of the population. Meanwhile, we have more than 400,000 Arizonans who lost their job. Did we create, or did the state create, a new crisis in all this?
It is one of those great contradictions that if we looked at Italy, if we looked at China and other countries, the momentum is such that this is an unknown. This is not, we certainly want to hold the leaders' feet to the fire, but do we risk people's health to fend off an economic problem if the economic problem is short term? So the question I would ask you is, yes, because testing is so limited, there are many medical professionals who are saying, until we get up to 100,000 tests a month, we won't really even know what the impact is. So does the impact get deeper? Does it get a little bit better? Until we really have the knowledge, it's hard to say. But certainly it looks bad right now because so many Arizonans are unemployed. And we went from a state legislature looking at a $700 million surplus to now a $1.5 billion deficit almost overnight. It looks terrible, but as many leaders have said, you have to think about the health of the citizens first, because if they're not healthy, they won't be able to spend in your business anyway.
Zach, those numbers are hard when you try to look at them from public health, but then look at it from an economic component. So how do we try to make sense of all this?
Right. First of all, I don't think that we look back on the recent past with any regrets. I think we made, in general, the right decisions to make sure we didn't have a bigger problem with the data that we knew we had. But I think we're seeing some preliminary data that points to Southern Arizona, at least, maybe having already peaked. We've seen Governor Ducey ask local hospitals to increase capacity. Increased capacity has happened. We're not seeing the surge that we thought we would. I think the middle ground approach is what I hope the governor will do, and that is take it, phase by phase by phase, start slowly reopening parts of the economy, making sure that people are still encouraged to go out with masks, that restaurants aren't as full, but to start slowly reopening. I think we have the capacity that if things were to surge a little bit, from the numbers that I see, I think we could manage it. I don't think it's keep it closed until we have more testing or antibody testing. I don't think it's reopened tomorrow, but I think we're pretty close. And I think so in Arizona, at least, in a good position numerically where we can start the phase in approach that I just mentioned. I think it's in the middle. I don't think it's either or, nor does it have to be.
I agree with Zach. In an ideal world, if we felt like we had a little bit more information, it makes sense to gradually reopen, but that reopening probably isn't May 1st. It may be a little bit later. But the thing I keep wondering about is how much is the carrot and the stick? How much is putting out an artificial date and getting people amped up for that date and then having to amend it? That's a real challenge too, because again, we're in this unknown period right now.
Let's talk about local mayoral leadership because early on we did see both mayors of Tucson and Phoenix sort of, dance around the issue with the governor and maybe force him to make some decisions that perhaps he wasn't ready for.
Right. My sense of things from what I'm hearing down here is that the mayor and council here in Tucson are going to try to align a little bit more closely with the governor. So I think where the governor moves, I think the city will move as well. In the beginning of this, I think the city of Tucson was moving further ahead than the governor. And that happened twice. And I think the city of Tucson had a good pulse on things. They moved in the correct direction about 48 to 72 hours earlier. I think they deserve credit for that. On the back end, I expect to see state and region be more aligned. I do know one city council office has already preemptively said we're closed until June. So maybe they know things that, again, we don't know and they aren't talking about it. But I expect to see a little bit better synchronization on the back end of this.
Steve, who's calling the shots?
Well, Lorraine, that's a great question because I think the governor is, for the most part, calling the shots, although he does have a lot of pipelines to the business community. We've heard a lot from Glenn Hammer from the Arizona Chamber of Commerce and Industry. He's been very aggressive, whether it's coming to nationally from the Paycheck Protection Program or from a local standpoint. And I think that what has happened now is we saw weakness in the business community before, and we're seeing more assertiveness there saying, yes, 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 unemployment is killing us. This is an economic downturn, but we need to be gradual. And I think the governor is hearing a lot of that in his ears from business leaders. I would say it's the governor's call with some influence from the feds and some influence in the business community. But ultimately, I do think he has the power and is going to assert it.
420,000 Arizonans out of work, $150 million in unemployment doled out. Is this sustainable and for how much longer?
Yeah, I think we see state level and local level being really dependent on the level above it. And I don't think that it's sustainable. And I think we're in for an 18 to 24 month recovery period. It's not going to be great recession levels because we don't have a great recession. It's structurally different. But to me in Pima County, I can't speak to Maricopa, this is going to be an 18 to 24 month recovery. I don't think enough people are thinking in that direction. I don't hear enough leadership speaking to that. But I think that's the reality, to get that many people back to work. And this has uncovered how how some of the economic disparities, the socioeconomic disparities, it's all been exaggerated. We're going to see the kimono opened on that here pretty soon when we start to reopen. I think it's going to give us an indication of the long road that we have ahead of us for sure.
And to piggyback on what Zach just said, Lorraine, the key thing is going to be whether these small businesses can survive. If the loan programs, if we end up with 18 to 24 months, I'm with Zach, it's somewhat pessimistic, but it's not if these small businesses don't survive, because that's the core. The bigger businesses will survive and they'll be able to rehire, but not enough people fast enough.
Let's say the governor makes some sort of announcement that says May 1st, Arizona goes back to business, perhaps the way Georgia is taking the lead on this. What becomes of Arizona? How is it different?
Well, Lorraine, the one concern I would have initially, frankly, is that we expect now, based on what we've heard earlier this week, the legislature is going to adjourn on May 1st and may take another several weeks off. The governor will probably call them into special session. It will not look good to me, at least, if the legislators who we've elected to be our representatives are not thinking they're comfortable going to work. So why would they send the rest of the state back to work? I think the governor might have to consider something like that, even by optics. It just doesn't look good.
Yeah, I think on the recovery front, I think we're going to have to explore things like public-private partnerships to fund everything from community education to economic rebuild to small business restarting. I think that the platforms that a lot of electeds campaigned on, are campaigning on, a lot of business focuses is going to have to be really redirected towards recovery, recovery, recovery. And I think, if we can benefit from some federal infrastructure funds, that's going to be helpful. But I think infrastructure, education, and economy are going to be the things that we're going to have to locally seed ourselves, and we're going to have to start doing it immediately, at least here in southern Arizona.
Okay, making sense of the unknowns. My thanks to both of you, Steve Goldstein from KJZZ in Phoenix and Zach Yenser from the Tipping Point in Tucson. Outside of Tucson and Phoenix, the state's farming operations face their own set of challenges caused by the outbreak, a multi-billion-dollar industry in Arizona that may see those revenues tumble in some sectors. Tony Paniagua has more.
Stay-at-home orders due to the coronavirus have led millions of Americans to avoid the office and do business online. But in Marana, sheltering in place is simply not an option for Daniel Pacheco.
We have to deal with the schedule that Mother Nature gives us. We plant our cotton in middle April, and so we're carrying on and doing what we have to do.
Pacheco runs the farm that has been in his family for 3 generations. He's planting cotton on more than 1,000 acres and growing about 750 acres of durum wheat.
Especially right now with watering wheat and planting cotton, I'm working 11 to 12-hour days a week, 7 days a week. Most people don't want to do that anymore.
Pacheco says social distancing isn't difficult. Literally, it's the way things are done out here anyway. But he's adamant about sticking to those standards to prevent his employees from getting sick.
Agriculture is very labor intensive. We have a hard time finding workers. Luckily, we have a good crew this year, and we're hoping to keep everybody healthy because we would be in real trouble. You can't just stick anybody on a tractor who doesn't know how to drive one or how to do the job that they need to do.
Keeping the virus at bay isn't Pacheco's only challenge in recent days. The havoc wreaked on the international economy also hits close to home. China, one of the most impacted nations, imports Pacheco's Marana-grown cotton. And his wheat? This crop usually goes east across the Atlantic Ocean.
The end user of our grain is Italy. Italy is one of the countries that was hit the hardest by this virus. We assume they're going to honor their contracts and continue to buy our grain, but, you know, anything can happen. We don't know what the markets are going to give us.
That uncertainty is one of the biggest challenges nationwide. George Frisvold is a professor of agriculture and resource economics at the University of Arizona.
Usually when you get some kind of shock, it's like a supply shock, like a drought or a flood or a frost that affects literally what gets produced. And then you have demand shocks, things like food safety concerns or scares or recessions that are negative demand shocks. What coronavirus did is it simultaneously created supply and demand shocks. So for example, like a lot of milk goes to schools and school lunch programs and institutions. And I don't know what's been going on so much in Arizona, but I know in other parts of the Midwest, dairy farms have actually been pouring milk into the ground. Things to be concerned about are things that we can see in other parts of the country. There's been meat slaughterhouse and packing plants in other parts of the country that have had to shut down because workers had contracted coronavirus.
Back on his land, Pacheco is moving forward with planting, even though today's cotton prices are less than half what they used to be a decade ago.
Last year, our prices were held down because of the trade wars between the U.S. and China. A lot of those trade agreements were made. The price outlook was starting to look better, and that was before this virus hit. Another monkey wrench into the whole market outlook.
In 2011, Pacheco says 1 pound of cotton fiber sold for about $1.20 a pound. This year, in the new coronavirus reality, it's down to about 53 cents per pound, even though it costs them about 58 cents to grow it. So why operate at a loss?
If we were to go off of today's prices, we probably wouldn't be doing it. We're hoping that manufacturing will get back up to speed and our markets will go back up, hopefully in October when we're harvesting. The saying goes, with farming, you have to be eternally optimistic.
Medical experts are also closely watching the government's response to the crisis, including Michael Warby, an epidemiologist at the University of Arizona. While he supports the decision to resume elective surgeries, he also says Arizonans should remain cautious.
there's a balance here, and I think this was a good move. That the economic impacts are one thing, but people are suffering. People are waiting for important surgeries that we call them elective, but they make a huge difference to people. And it also cuts both ways when you're looking at healthcare workers who are going to be exposed to more people in the community. And what we do know, and it's becoming more and more clear, is that a lot of transmission of this virus is happening before people realize that they've got it. And so, yeah, there are risks to the people going in for those procedures and to the people, the healthcare workers doing it. But, to some degree, life does need to go on, and that's an important area to get back to.
Any indication that the warmer weather, the summer temperatures, will help in this fight?
I certainly see no indication at all that we're catching a break in that way. And so we are going to have to just maintain some of these measures. And if we do start folding back some of these things like elective surgeries, we're all going to have to be really smart and responsible. Again, bearing in mind that you can transmit the virus before you feel a single twinge of illness.
There are still people who are naysayers and believe that they're healthy and they don't have COVID and they can't pass it on. What do you say to them?
This is not an individual level problem. This is a population level problem. And so the choice that you make for yourself doesn't just impact you. That if the virus manages to make its way into you and you don't take those precautions, it could then be the virus that gets into a long-term care facility or another area where people are so vulnerable and dying at really, really high rates. The case fatality rate of this virus for people over 80 is about 14%, which is about the same odds as Russian roulette. And that's not really an acceptable risk to put someone else at because of your choice.
Do you see a possible surge coming in the fall? We've heard other physicians or epidemiologists say that.
If we release these social distancing measures too early, we're going to see a surge, whether it's in the summer or the fall. The only escape from this is TTI, test, trace, isolate. So to the extent that we can, we need to ramp up the virus testing, this diagnostic testing that tests in real time, are you infected? We need to be at much higher levels of testing. And then with that information, we need to trace other individuals who positive cases may have been in contact with, and then isolate those cases so that they don't make more cases. And again, we don't have to catch everyone, but if we concentrate and do this well enough, we can tilt the playing field back in favor of us versus the virus.
Okay, Dr. Michael Warby, thank you. Healthcare workers will continue to be on the front lines of the crisis. In Pima County, we got insight on whether or not they have enough protective gear from Dr. Bob England, interim director of the county's health department. What's the personal protective equipment situation in Pima County right now?
Still not enough. I'm not at all sure why it's been so hard for this country to produce some of the material it needs. But the hospitals right now for day-to-day use are in really good shape. Some of our long-term care facilities have issues, as do some of the first responder agencies, but we've been pushing it out just as fast as we can.
There are some hospitals and doctors' offices and clinics that are, obviously they're all running according to CDC guidelines. Any reports that they've had to push the boundaries because they don't have the equipment and they're trying their best given the circumstances?
Sure, in some locations they are telling us that per existing guidelines coming out from CDC and our state, that they are stretching the supply, but they're doing it the way they're supposed to. They're doing it in a relatively safe manner, I would say.
The headline this week, of course, is that elective surgeries, procedures can resume. What was the logic behind saying we've got to stop some of these things in the meantime?
The original rationale was to empty out the hospitals and make sure we had plenty of capacity for the early phase of the epidemic in case it really surged and became overwhelming. The kind of stuff that you see out of New York City, for example. We've stayed well below capacity here throughout Arizona and in Pima County.
Early on in this conversation, many of us were preparing for the peak of COVID cases to hit in May. What's the situation right now here, the last week of April in Pima County?
There have been all kinds of different models out there. You got to understand one thing about all those mathematical models that you've seen in news reports and in articles is that they're not so much designed to accurately predict the future as they are to show you, relatively speaking, what happens if you do different courses of action. The one thing you don't want to do is open up everything all at once too soon. We've made a lot of sacrifice, economic and social sacrifice to this point, to keep the spread of the disease slow so that it doesn't get out of control. And it would be a real shame to squander all of that sacrifice by opening up so suddenly that you essentially see what you would have seen if we hadn't done anything in the first place at all.
Would you say that Pima County is in decent shape?
Right now, we're looking okay. That's as of today. Everything depends on how much is relaxed, how fast, and how we do it. We need to do it rationally. We still think, for example, that children are infected not just less severely, but less often than adults. But given that, it probably makes sense to open up some children's activities, whether you're talking schools or summer camps or something like that, sooner than some other businesses. So we're working pretty much hand in glove, all the counties and the state health department, in developing our criteria that we think are important for a phased reopening.
That's all for now. Thanks for joining us. To get in touch, visit us on social media or send an email to Arizona360 at azpm.org and let us know what you think. We'll see you next week.